Thank you, Mr. Chair. I move to strike the last word.
Gentleman's recognized. Gentlelady's recognized. Sorry.
These funding freezes have had real consequences in our communities right now. After the funding freeze, community health centers in Virginia had to close their doors because they couldn't access funding from the federal government to pay their staff and stay in business. These community health centers provide essential services such as preventing and treating substance abuse disorders, delivering primary care and dental care, and offering low-cost prescription drugs. And for many families, especially in rural areas, they already have to travel far. They already live in healthcare deserts and pharmacy deserts. And the president's funding freeze made that situation even worse. Just yesterday, there was an article that came out in one of my local papers that talked about the increase in the number of pharmacy deserts. In Virginia, there are 51 pharmacy deserts, and these have all been identified in areas that have higher proportions of Black residents, uninsured individuals, or individuals only covered by Medicare and Medicaid, low-income households, and areas of poverty. And it identified 2 pharmacy deserts in Manchester and Fulton neighborhoods in the city of Richmond, which I represent. And earlier this month, directly in response to the president's funding freeze, the Capital Area Health Network had to close its doors in both its Manchester and Fulton locations. And those patients who had appointments were told, your appointments have been canceled, you need to go to a different health center. And the pharmacies that are in those health centers are now not available to those patients, getting rid of one of the few pharmacies that exist in those pharmacy deserts. I also spent some time in the southern part of my district, which is very rural, during the break. These are people who, many of whom work in Newport News for the shipyard, many of whom have to drive either to Richmond or Newport News for health care. And when the South Side Community Health Center closed, which is about halfway between the southern part of my district and the city of Richmond, those folks now have to drive an extra 30 minutes to get access to essential health care. And so the reason I support this amendment is because this is just one example of many, how an illegal funding freeze that the courts have said reverse are still having an impact on vulnerable communities for people who just want to be able to get their prescriptions filled for life-saving medicines or get access to preventative care or emergency care, and these funding freezes have made it even harder. These are our neighbors, these are our friends, these are our veterans, these are caregivers for many of our other families, and we cannot sit by while the administration ignores court orders when those court orders could literally be life and death for many of our constituents. Thank you, and I yield back.